Καλημέρα σας. Hello everybody. Good morning from Athens. I would like to thank first the conference committee for giving us this great opportunity to meet again and discuss on current challenges on tobacco control and harm reduction.
Good morning everybody. Καλημέρα σας. Dear colleagues and friends, I would like to thank first the conference organizers for having brought us together to discuss current challenges on tobacco control and harm reduction. I would also like to thank doctors and scientists that embraced our project Help Her Quit, the experts, the hospital administration and the Greek authorities. Help Her Quit is a women-centered strategy in tobacco harmfulness, knowledge and smoking cessation upskilling for OBGYNS. Let me remind that women smokers compared to non-smokers demonstrate higher risk of cancers, including many forms of gynecologic cancer, coronary and vascular diseases, chronic obstructive lung disease, reproductive and embryo development problems, and osteoporosis, and many more other clinical entities. Tobacco use shows harmful effects on women of all ages. One of the biggest problems in our country, in Greece, is that Greek women remain one of the world's leading smokers. According to World Bank statistics, in 2016, Greece's women smokers represent a prevalence of 35.7%, which makes them pioneers in smoking. This is the challenge for us. We believe the key enabling actor to help women stop smoking is the obstetrician gynecologist who, when trained, is well positioned to screen and counsel women on tobacco consumption and cessation. And we are two partners with strong commitment to help women quit smoking. That's why we named our project Help Her Quit, and because we represent a hub for gynecologists. We represent a hub for gynecologists because we have more than 1,000 gynecologists working with us. So to this project, we are two strong committed partners in helping her quit. ESO, the biggest private women's hospital in Greece and one of the best in Europe, with more than 8,000 deliveries per year, hundreds of cancer treatments, an ICU, a modern neonatal ICU, and millions of radiology and laboratory tests. And the second one is the Institute of Life, one of the best European assisted reproduction units with more than 3,000 cycles per year, setting up new techniques such as, for example, the maternal spindle transfer, which is unique, and a modern andrology department. Help Her Quit is a 2-year project with several actions and activities all the way. Among others, as COVID-19 threatens the humanity, we will put efforts also in smoking, women's health and COVID-19 infection. Some of the milestones of the project include mapping the level of awareness of OBGYNS in tobacco and women's health science, building OBGYNS midwives and nurses' capacities to help women in smoking cessation, developing curriculum for the doctors on women's health and smoking, including all issues on modified risk products and harm reduction, and smoking cessation guidelines based on international societies and international organizations' guidelines, informing women on smoking harmfulness and how they can be helped to quit, and promote to the medical societies, disseminate, update with news achievements and data to the public and to the authorities. Even before the starting of the project, we created a great consortium composed from medical doctors, experts, leaders in smoking cessation, and young doctors. So this great consortium is composed from more than 60 leaders, more than 15 experts, and more than 50 young doctors who are already on board and voluntary. We created a great site that you can visit, and we have already social media, and we planned a kick-off meeting at the end of September, and we already created a leaflet for women and the public, which is available also in hard copy. And we plan 3 workshops, and we invite experts to be our speakers. At the end of the project, a toolkit for OBGYNS will be ready and at the disposal of medical doctors, and it will be a publication at Broken Hill. At the end of the project, guidelines and materials will be promoted to associations of OBGYNs, midwives, women, and to the authorities. At the end of the project, more than 60 OBGYNs and more than 100 midwives will be competent in harm reduction knowledge and helping her quit. It is very important for us that at the end of the project, more than 2,000 medical doctors will have access to Help Her Quit curriculum. Trained doctors, young doctors, will be entitled Help Her Quit ambassadors. At the end of the project, doctors will have strong scientific knowledge about smoking harmfulness, harm reduction, and they will be upskilled in helping women stop smoking. And I hope that less women will be smokers, so more women will be happy. Before closing this presentation, I would like to invite you to visit our site and find us on social media, and you are welcome for your input and contribution, and if you are an expert, please be so kind to be on our side. Finally, I would like to thank our sponsor, Philip Morris International Science, that support this great project with discretion and a great respect to our scientific work. It is our common objective to succeed in this effort, to help her quit. Thank you very much.
Thank you again. Γεια σας, καλημέρα.